Hello, welcome to the Spot Robotics Podcast. Today I'm joined with my guest, Mr. Bhav, Jain, where we discuss medicine, technology, and nonprofit ventures. I hope you enjoy this podcast where you can gain an insight into technology in the modern world and get a new perspective and advice on succeeding in these fields. If you enjoyed the podcast, follow us on wherever you get your podcast, and if you'd like to support us more, give us a review. Thank you and enjoy. So my first question I had was, what does your day-to-day routine look like being a student and the president of the Connected Foundation?
Yeah, well, first off, thank you so much for the opportunity to be speaking with you, and I'm certainly very excited to be here. My name is Bhav, and I'm currently a first year medical student at Stanford. So, as part of that role, I get to experience a combination of both active lecture style learning and also engaging with patients. We typically will have class in school from around 9 to 4 or so on most weekdays. And my first semester, our class is mostly focused on the basic clinical and scientific aspects of medicine. So that ranged from embryology and histology to biochemistry and genetics. We also spent roughly 4 months studying the full anatomy of the human body. And that was also paired with some fundamental clinical skills. So we, as early as our first week, engaged with our first patient actor and got to learn how to do the full patient history as well as conduct a cardiovascular pulmonary and abdominal exam. So it was a very, I think, neat mode of learning, very different from anything I had experienced back in high school or college, where that was largely, if not all, lecture based. Now, as I start my spring, we are going to wrap up our more foundational scientific classes and actually start our organ blocks. And so that's going to include everything from the nervous system and immunology to microbiology, the heart, and other organ structures. And we'll continue learning our patient clinical skills as well. By the time I start my third year of medical school, I'll actually be in the hospital every day on different shifts. So I'll effectively be learning from resident physicians and attendings on how to translate all of the skills and knowledge that I learned in the first 2 years of medical school to actual care for patients. And those rotations typically will consist of everything from internal medicine to OB/GYN to surgery and the emergency room. So that's the general structure of medical school. By the time you reach the fourth year, you are applying for residency and thinking about exactly which specialty you might want to enter into. And so that's the general structure of my day as a medical student. Being at a very diverse school such as Stanford, though, I also have the opportunity to fairly routinely engage with law students, business students, PhD students, and undergrads as well. And so, as part of that, I'm able to engage in a substantial amount of research spanning areas like health law, health economics, global health, and others, and also more broadly engage in my interests in geopolitics. As for your other question on my role as the president of the Connected Foundation, so I'll start by establishing some context exactly as to what our organization does. We launched it back at the peak of COVID in early 2020, and that was actually inspired by my experiences engaging with my grandmother and other older adults who had been in lockdown over the course of COVID. In my grandmother's case, she was actually in her apartment in India for over a year and had not been able to leave. And having heard many similar stories from older adults here in the US and other countries, paired with the fact that for the first time, youth also had been sent home from high school and from college. So I think that was a truly unique opportunity whereby both older adults and youth had been experiencing the same state of loneliness and social isolation. So I kind of encouraged by that initial impetus, I worked with a group of other college students in the Boston area at first to basically established these partnerships and connections with nursing homes, senior centers, and assisted living facilities. And since everyone was in their homes as part of lockdown, we actually started by having our high school and college age students zoom into these nursing homes and senior centers and actually just engage with older adults, have general conversations on how everyone is doing. We then shifted into actually hosting classes on a variety of topics, such as the importance of international humanitarian law, the influence of classical music on modern music, and other topics that would be of interest to a wide intergenerational audience. As we gained more and more traction on this mission, though, over time, we were able to actually expand across to more than 20 states and engage over 500 high school and college age students. And since then, we've expanded our mission not only into having these more general conversations, but also into helping older adults understand their health insurance options, helping them understand how to actually get screened for various mental health and physical health conditions as part of their general health and aging. And now are actually increasingly shifting over into helping improve the experience of caregivers as their own parents and other older adults age. So really, we're hoping to invent and set this example, the model of a truly youth-led intergenerational organization that leverages advocacy, research, and service work to improve the lives of both older adults and youth.
Mm-hmm. That's really interesting. That's quite the mission. My next question was, um, I want to ask what work you did at Compass since you were the chief operating officer over there, and could you explain what Compass does?
Yeah, absolutely. So Compass was the other major initiative that I had the opportunity to be involved with over the course of my college years. And this was likewise heavily inspired by the events transcending as part of COVID. So I mentioned earlier how, the lockdown forced many older adults and youth to go home, and that inspired my work with Connected. But certain more marginalized groups unfortunately did not have the same benefit as everyone else in terms of having a home to actually go back to, especially the unhoused population either had to be in a number of different homeless shelters, basically hopping around in a very transient fashion, or worse yet, were on the streets for much of COVID. And that only exacerbated the spread and effectively led to a state of worsened outcomes, high ER usage, and others. So basically, the goal of Compass was to offer the unhoused population an entryway into getting tested and screened for COVID, because this was a group that was oftentimes neglected by the existing public health mandates. They oftentimes had among the lowest rates of public health access and English literacy. And so we felt it was important to offer them an entryway, a path into at least getting screened and keeping ascertained about their health status. So effectively, we launched an SMS based triaging solution where anyone could text a set number that we had established. And upon texting that number, they would be asked to answer a series of questions. Actually, it was the standard CDC question used for COVID screening. It would ask about their exposures, any recent exposures or contacts that had been screened positive for COVID, it would ask about their symptoms, if they were having flu-like symptoms or others. But it was all asked in very simple, easy to understand language. And we actually had this available in more than 10 different languages. As I mentioned, the unhoused population is a very diverse population from an ethnic standpoint and speaks English, Spanish, and several other languages. So offering this service in all of the major languages was of utmost importance. But basically, after they answered this series of questions based on their zip code, we were able to give them the address of the nearest testing site, and if possible, actually directly schedule their COVID test for them, typically on the same or next day. And all of this was offered free of charge we were fortunate to be able to operate the Compass SMS service through the support of a number of grants and philanthropic organizations, including the Clinton Foundation. So that was the scope of Compass. In the aftermath of COVID, we also began actually expanding this service more broadly and attempting to tackle the issue of patient scheduling and patient intake. Because if COVID showed anything, it effectively revealed that our healthcare infrastructure was extremely slow and inefficient, that it would take weeks or months for patients to actually get access to a doctor's appointment. And so we actually expanded Compass to help low resource hospitals and provider practices, especially in low and middle income countries, use SMS as a means of having their patients actually schedule their medical appointments, especially if they didn't have enough staff to handle phone calls. Because typically phone calls are the major way that people either get screened for diseases like COVID, RSV, or flu, or even schedule their medical appointments. As much as we've tried to encourage a shift towards using platforms like Epic MyChart or other EHR systems, calling still seems to be the dominant way of actually engaging with the healthcare systems. So this SMS-based approach attempts to offer a new entryway into the healthcare system.
My next question was, what was your experience at MIT, and what are some things you learned there since you were an undergraduate researcher and a teaching assistant?
I loved my experience at MIT. I think that MIT really opened my eyes into what's actually possible when you are able to access such a diverse group of people who are passionate about using science and technology, very broadly defined, to actually solve major social impact issues of the day. So, I entered wanting to study at the intersection of both computer science and also neuroscience, and spent my first year or so pre-COVID actually working at the Whitehead Institute, where my work was focused on understanding the role of astrocytes in exacerbating Alzheimer's and Parkinson's disease. So I was able to work in the laboratory of Rudolf Enisch, who's a very prominent and eminent biologist at the Whitehead Institute. And that really opened my eyes into how to leverage basic science and the most advanced molecular biology tools to better improve our understanding of the human disease and human condition. As I mentioned, though, as COVID set in, my interest expanded, and I realized that we have some very fundamental gaps in our healthcare and public health system that's going to need an understanding of other spaces like the social sciences, the humanities, economics, business management to actually solve, in addition to understanding the basic science and clinical science. So MIT really offered me the opportunity to kind of expand my interest. I began taking several economics classes on issues such as poverty, healthcare economics, and how to leverage the government and other public sector institutions to more effectively finance solutions to our most pressing social issues. So I think being in that atmosphere where I was very quickly able to pivot over from studying the basic science of neurobiology and Alzheimer's and Parkinson's to this, in some sense, broader scope of healthcare systems and healthcare delivery was an immense opportunity. I spent the bulk of my last 2 years, as I mentioned, trying to lead and implement these initiatives around Compass and the Connected Foundation, but also got to engage with researchers across MIT as well as the Boston hospitals on topics such as disparities among various racial and ethnic groups and access to care, delays in treatment among various racial and ethnic groups, and then more recently, understanding how to build more cost-effective and equitable healthcare systems, both here in the U.S. and also in global low and middle income settings as well. So that was the bulk of my experience at MIT. To this day, even while I'm in medical school, I keep in touch with many of my friends, actually both and also my faculty advisors back from college, and very much excited to see how this education in the basic sciences, in the technologies, and in the other social sciences is able to inform my understanding as a future physician who is interested in uplifting the broader humanity through these various causes, especially surrounding global public health.
Hmm. That's really a beautiful mission. My next question was so I want to ask like, what is some advice you'd have for a high school student trying to be in your career or like trying to be in your industry?
Well, I would say that, especially at the high school stage, it's very important to be someone who is avidly interested in engaging with any opportunity. I think as high school students, that's effectively the most visionary and creative that one is going to be. I've seen that as one goes through college and either industry or graduate school, our focuses tend to become more and more narrow. And we tend to have to balance and negotiate across several more constraints, which leads to our visions being, as I said, somewhat more narrow. But at the high school stage, you really have an optimistic view of what is possible. You're, in some sense, unbounded by these various constraints. So I would encourage high school students to eagerly take up any opportunity that comes their way, and also actively seek them out. I think for high school students who are particularly interested in medicine, there is no better way to understand if it's a field that is right for you than by shadowing, by going into your local hospitals and actually experiencing the full spectrum of patient care across the ER, the outpatient clinic, the operating room, understanding how surgery and medicine work to improve patient outcomes, seeing if you like your local doctors. I think so much of medicine and any field that you choose is often also based on your match from a personality standpoint. So if you go in and you start to shadow these local nurses and physicians and you actually like their schedule, you like their job, and you like them as people, then that is certainly a good sign that I think medicine will be a good fit. I think in addition to shadowing and gaining that hands-on clinical experience, there's also an immense opportunity to engage in public service more broadly. I think that we're seeing a new era of healthcare and medicine shift from solely patient care to wanting to think about issues more broadly, as I've outlined, especially issues around public health, building stronger public health systems, engaging in basic science to actually push forward the next wave of biomedical advancements. So many of the most common and prevalent diseases that we now have that our population might be burdened from is simply due to an early or nascent understanding of the science. And so it's going to actually take physicians and nurses and other healthcare experts who want to understand the basic science of any of these issues. So I would say, in addition to shadowing, engaging in a few research opportunities over the course of high school, applying to summer research programs that let you get direct mentorship from world-class faculty at your local school, and seeing if you enjoy that general process. And I think lastly, engaging in advocacy initiatives, finding a local social issue that affects either yourself as a person or your broader community, and seeing if you're able to actually pull people together and align them towards that same vision to solve an issue. So in my case, especially in college, those issue areas ended up being aging, improving the lives of older adults and those experiencing social isolation, and also just improving health equity, expanding access to COVID tests for everyone. Those were my main advocacy areas in college. And, I've seen others at the high school stage who are actually engaging with their local elected officials, trying to get laws and bills passed that expand access to healthcare or that improve access to housing sites for the unhoused population, or laws which improve access to healthy foods, right? So that there's an infinite number of social issues we have, and the youth, the high school students now are going to actually be the future leaders who end up executing on these missions. So having a taste of what issues appeal most to you, what sorts of people do you like working with, those are the questions I would focus on answering at the high school stage.
Hmm. My next question was, in your opinion, what do you think is the most important personality trait someone needs to be able to work in your industry and be successful in your job?
So I'll answer this with perhaps two traits. One that I find particularly relevant to medicine, and the other which I think applies to any industry. So the trait that I think is especially eminent in medicine is that of empathy. I think to be able to go through all the years of medical school, of residency, and of direct patient care as an attending physician just needs immense empathy. You have to be inspired by the mission of directly helping people each day, right? And based on which field of medicine you enter into, you might not see the direct fruits of your labor on an instantaneous basis. It may take several years for you to actually see your own patients get better, and they might not always get better. But I think the decision to come back to the hospital or the clinic every day and leverage your talents and gifts to help others comes from some source of empathy. So I think that's an immensely important trait. The other trait, though, which I think applies to any industry you enter into, is being able to stay consistent and persistent, right? So I think, as I mentioned, the path into medicine is an extremely long one. You have to go through college, medical school, which is in its own right 4 years, and then residency, which can be anywhere from 3 to 9 years based on which specific specialty you end up doing, or even longer if you then opt in for a fellowship. So it's a very long path, but every other industry has its own nature of being long as well. If you are entering into business or finance, you will oftentimes then have to go on to business school or work across multiple organizations in entry level roles before you then have the opportunity to lead. If you're entering into the broader social services or the public sector as a civil servant, oftentimes that's a very long path as well. So I think in some sense, all of these paths are very long term. And I've seen, at least among my mentors, those who tend to be the most successful are those who are able to stay very persistent and dedicated in some sense to the mission over these long stretches. They're able to have a clear sense of their purpose, what their mission is, but they are aware of the fact that it will likely take several failures before they're then able to succeed. Having that understanding and not swaying off the path because of a few setbacks is, I think, extremely crucial. I often tell people, don't let setbacks actually set you back, right? If anything, setbacks should serve as an opportunity to pause, seek a moment of clarity, reorient yourself, and then continue on as intended, or shift and pivot as needed. But I think the people who are able to move on despite apparent setbacks will be the most successful, whether it's in medicine or in any other space.
Mhm. My next question was, and something I found interesting was, what was your work that you did as a product management fellow for the United States Department of Health and Human Services?
So I had the opportunity to work at the Department of Health and Human Services in between my sophomore and junior years of college. And this was also an experience that I opted in for as part of my insights into COVID. I wanted to understand how might the government, and in particular the federal government, be responding to the public health crisis that was COVID. Through Compass and the Connected Foundation, I had an understanding of how local government was actually handling the crisis, because much of my work with those two organizations involved engaging with local stakeholders, local public health agencies. But I was always very curious as to how does the most broad and expansive level of government actually handle an issue that was as major and unprecedented as this one was. So I was able to apply to a program called the Civic Digital Fellowship, which effectively paired students with federal agencies to explore how can we use our skills in technology to actually contribute to civil and public service. And so having spent some time in college studying computer science, it certainly seemed like an aligned opportunity. But given my long-standing interest in healthcare and public health, being paired with the U.S. Department of Health and Human Services, or HHS, was a very natural fit. So at HHS, I was able to work on a number of initiatives spanning helping the agency actually engage every major hospital system in the country, to developing an open data sharing framework to better encapsulate and understand and track the social determinants of health. So, just to dive a bit more into each of those, I learned over the course of my summer that much of the work at HHS actually involved engaging with hospitals and state and local public health agencies to understand that everyone had the same guidance. Everyone knew what the latest mandates were from HHS and from the Centers for Medicare and Medicaid Services, whether that be ensuring that hospitals were compliant with the policy of reporting their daily hospital numbers each day, numbers around COVID infections, how many patients actually had COVID, how many patients were discharged, how many patients were in the ER. So all of those numbers were expected to be reported by each hospital to HHS on a daily basis, and we were able to steward hospitals towards that aim. And the other arm was, in some sense, exposed by COVID, right? As I mentioned earlier, COVID exposed many of the gaps in access to healthcare that had existed for years, decades really prior. But it was only really during COVID that I think healthcare organizations began focusing on this issue of social determinants of health, the factors, upstream factors, which affect access to health and health outcomes, factors like housing, education, food, income, and others. And for a long time, hospitals had not been tracking these measures on a consistent basis. So at HHS, I had the opportunity to work with the Assistant Secretary for Health and the Office for the National Coordination for Health Information Technology to think about and ideate a framework that would actually very explicitly give guidance to hospitals on which measures, which social determinants measures should they be collecting from every new patient who enters the hospital. How should they then be reporting those measures to their local public health agencies and subsequently to us at HHS? So those were a couple of the projects I had the opportunity to engage with at HHS, and certainly they've shaped my broader interests now in public health at the local, national, and global scales.
I had a question. So when you mentioned COVID-19 a lot throughout the interview and about the accessibility of health, with the I guess the recent movement in AI, generative AI, do you see any impact in wide access to healthcare in an overall sense with your work and everything?
It's a very good and forward-looking question. I think you're absolutely right that AI is going to be playing a leading role in healthcare, both how healthcare is delivered, obviously, but also I think, as you rightly point out, how healthcare is accessed, which is an issue that more and more healthcare organizations have been thinking about. Because on one hand, and it's not just AI, but more broadly internet and the increased access to broadband,
Mm-hmm.
right? And the mandates or the waivers which were established by HHS during COVID, right? It was really during COVID where healthcare organizations were given the right and the legal ability to deliver much of their patient care virtually over telehealth. Before COVID, less than 5% of patient visits were done on a virtual manner. Now, anywhere from 10 to 20% of patient visits are actually done in a virtual telehealth manner. So certainly COVID was a major catalyst for the use of broadband in accessing healthcare. And we see that trend perpetuating now in the post-COVID era. So I see that in some sense as a double-edged sword, right? On one hand, you're able to expand access to care because people no longer have to go into the hospital. Doctors are able to see more patients in a given day, and especially for those of us who might, have very busy work or personal family lives who are not able to make every single doctor's office appointment in person, certainly it increases access and efficiency. I think, though, we're going to actually see, and in some sense we actually have seen, the disparities which emerge out of this issue, where you have those who are in rural, low-income settings who might not have access to broadband, stable internet access, or housing, who are not able to actually access these virtual telehealth appointments. And in fact, that was the impetus for my work at Compass. Was we were very intentional about offering our services via an SMS line only. Because if we had used an app or a website, that would have inherently decreased access to those who only had access to internet. By having SMS, a far higher share of Americans have SMS. And when you go globally, the gap between those who have SMS and those who have 4G or 5G is even higher, right? So this shift towards virtual telehealth care is going to exacerbate disparities if we don't pair it with policies that improve access to broadband. I think in a similar vein, the AI, the shift towards AI in healthcare is going to see a similar, basically, manifestation of disparities, right? Because AI inherently needs either smartphones or computers which are able to have the processing power to access AI, and to run these sorts of models that AI inherently is based upon, right? So I think that while AI might certainly improve diagnosis and care delivery and improve efficiency, if it's not paired with a detailed attention to the access inequities, it might only exacerbate disparities. I'll also add, even once everyone has access, there's this other issue of bias, right? So AI in healthcare has been shown to have various biases along racial ethnic lines, along income lines. There have been an area of recent studies assessing the accuracy of ChatGPT and its ability to give medical diagnoses to patients of different backgrounds. And we've seen that AI consistently over or underestimates the prevalence of common chronic diseases for racial minorities, including Black Americans, Asian Americans, Native Americans, and Hispanics, right? So we are already seeing these baked biases. And the reasons for these biases are manyfold, but emerge from the fact that the data that the models are being trained on typically are themselves biased. They typically suffer from missing data, from selection bias, and who actually was in the health registries or medical records that the model was then trained on. So there's so many biases that are used to train these models. It's no surprise then that naturally, when you use these models in the clinical setting, they lead to suboptimal outcomes. So I think that's the other challenge that we are going to have to navigate. But I do remain overall, on the whole, optimistic about the use of AI in healthcare. And I think this new wave is going to see a lot of growth as we move on into the next 10, 15 years from now.
That was my final question. I want to thank you for your time, for being part of the interview, and really insightful take on a lot of the stuff, and like a great experience overall and a great mission.
Great. Well, thanks again for the...
That's it for today's podcast. Again, if you enjoyed this episode, follow us on wherever you get your podcasts, and if you'd like to support us even more, rate us. Until then, we look forward to seeing you in a future podcast very, very soon.